Female infertility due to ovarian factors is a common cause of infertility in women. Here are some possible ovarian causes of infertility. Ovarian causes of infertility. 1. Polycystic ovary syndrome, PCOS, a hormonal disorder that affects ovulation and can lead to infertility. 2. Ovulation disorders. Irregular ovulation or anovulation, absence of ovulation, can make it difficult to conceive. 3. Premature ovarian failure, POF, a condition where the ovaries stop functioning before the age of 40, leading to infertility. 4. Ovarian cysts or tumors. Abnormal growths on the ovaries can affect ovulation and fertility. 5. Endometriosis, a condition where tissue similar to the lining of the uterus grows outside the uterus, including on the ovaries, leading to inflammation and scarring. 6. Ovarian reserve, a decline in the number and quality of eggs in the ovaries, making it more challenging to conceive. 7. Ovarian surgery. Surgery to remove ovarian cysts or tumors can sometimes damage the ovaries and affect fertility. Symptoms of ovarian-related infertility. 1. Irregular menstrual cycles. Infrequent or absent periods can indicate ovulation disorders. 2. Pelvic pain. Pain in the lower abdomen can be a symptom of ovarian cysts, endometriosis, or other ovarian conditions. 3. Heavy or prolonged menstrual bleeding. Abnormal bleeding can be a sign of hormonal imbalances or ovarian disorders. 4. Weight gain or loss. Unexplained weight changes can be a symptom of hormonal imbalances associated with ovarian disorders. Diagnosis and treatment. 1. Pelvic exam, a physical exam to check for any abnormalities in the reproductive organs. 2. Imaging tests, ultrasound, CT, or MRI scans to visualize the ovaries and detect any abnormalities. 3. Hormone tests, blood tests to check hormone levels, including follicle-stimulating hormone, FSH, and luteinizing hormone, LH. 4. Laparoscopy, a minimally invasive surgical procedure to visualize the ovaries and detect any abnormalities. 5. Fertility medications. Medications to stimulate ovulation, such as clomiphene citrate or gonadotropins. 6. Surgery. Surgery to remove ovarian cysts or tumors, or to repair any damage to the ovaries. 7. Assisted reproductive technology, ART, procedures like in vitro fertilization, IVF, or egg donation may be necessary for women with severe ovarian dysfunction. Female infertility due to fallopian tubes. Female infertility due to fallopian tube damage or blockage is a common cause of infertility in women. Here are some possible causes of fallopian tube-related infertility. Causes of fallopian tube-related infertility. 1. Pelvic inflammatory disease, PID, a bacterial infection that can cause inflammation and scarring in the fallopian tubes. 2. Endometriosis, a condition where tissue similar to the lining of the uterus grows outside the uterus, including on the fallopian tubes, leading to inflammation and scarring. 3. Tubal ligation or blockage, a surgical procedure that intentionally blocks or cuts the fallopian tubes to prevent pregnancy. 4. Ectopic pregnancy, a pregnancy that develops outside the uterus, often in the fallopian tube, which can cause damage to the tube. 5. Fibroids or polyps, growths in the uterus or fallopian tubes that can cause blockage or damage. 6. Adhesions or scarring. Adhesions or scarring in the pelvic area, often due to surgery or infection, can cause the fallopian tubes to become blocked or damaged. 7. Congenital abnormalities. Some women may be born with abnormal or missing fallopian tubes. Symptoms of fallopian tube-related infertility. 1. Pelvic pain. Pain in the lower abdomen or pelvis can be a symptom of fallopian tube damage or blockage. 2. Heavy or prolonged menstrual bleeding. Abnormal bleeding can be a sign of hormonal imbalances or fallopian tube damage. 3. Infertility. Difficulty getting pregnant or recurrent miscarriages can be a symptom of fallopian tube-related infertility. Diagnosis and treatment. 1. Hysterosalpingogram, HSG, a diagnostic test that uses dye and X-rays to visualize the fallopian tubes and uterus. 2. Laparoscopy, a minimally invasive surgical procedure that allows a doctor to visualize the fallopian tubes and pelvic area. 3. Surgery. Surgery may be necessary to repair or remove damaged or blocked fallopian tubes. 4. In vitro fertilization, IVF, a type of assisted reproductive technology, ART, that involves fertilizing an egg with sperm outside the body. 5. Tubal reversal surgery, a surgical procedure that reverses a tubal ligation or blockage. Female infertility due to uterus. Female infertility due to uterine factors is a common cause of infertility in women. Here are some possible uterine causes of infertility. Uterine causes of infertility. 1. Uterine fibroids, benign growths in the uterus that can cause heavy bleeding, pelvic pain, and infertility. 2. Endometrial polyps, growths in the lining of the uterus that can cause heavy bleeding and infertility. 3. Adenomyosis, a condition where tissue similar to the lining of the uterus grows into the uterine wall, leading to heavy bleeding and infertility. 4. Uterine septum or bicornuate uterus, a congenital condition where the uterus is divided or shaped abnormally, which can increase the risk of miscarriage and infertility. 5. Asherman's syndrome, a condition where scar tissue forms in the uterus, often due to uterine surgery or infection, which can cause infertility and recurrent miscarriage. 6. Uterine cancer or hyperplasia, abnormal cell growth in the uterus that can cause infertility and other symptoms. Symptoms of uterine-related infertility. 1. Heavy or prolonged menstrual bleeding. Abnormal bleeding can be a symptom of uterine fibroids, endometrial polyps, or adenomyosis. 2. Pelvic pain or cramping. Pain in the lower abdomen or pelvis can be a symptom of uterine fibroids, endometrial polyps, or adenomyosis. 3. Infertility or recurrent miscarriage. Difficulty getting pregnant or experiencing recurrent miscarriages can be a symptom of uterine-related infertility. 4. Abnormal uterine bleeding. Bleeding between periods, after sex, or after menopause can be a symptom of uterine cancer or hyperplasia. Diagnosis and treatment. 1. Pelvic exam, a physical exam to check for any abnormalities in the reproductive organs. 2. Imaging tests, ultrasound, MRI, or CT scans to visualize the uterus and detect any abnormalities. 3. Hysteroscopy, a minimally invasive procedure that uses a scope to visualize the inside of the uterus. 4. Surgery. Surgery may be necessary to remove uterine fibroids, endometrial polyps, or other abnormalities. 5. Hormonal treatments. Hormonal medications may be prescribed to regulate menstrual bleeding or treat conditions like adenomyosis. 6. Assisted reproductive technology, ART, procedures like in vitro fertilization, IVF, may be necessary for women with uterine-related infertility. Female infertility due to cervical and vaginal factors is a less common cause of infertility in women. Here are some possible cervical and vaginal causes of infertility. Cervical causes of infertility. 1. Cervical stenosis, a narrowing of the cervical canal that can prevent sperm from passing through. 2. Cervical insufficiency, a condition where the cervix is weak and unable to support a pregnancy. 3. Cervicitis, inflammation of the cervix, often caused by infection, which can cause scarring and adhesions. 4. Cervical polyps, growths on the cervix that can cause bleeding and interfere with fertility. 5. Cervical cancer or abnormal cell growth. Abnormal cell growth or cancer on the cervix can cause infertility and other symptoms. Vaginal causes of infertility. 1. Vaginismus, a condition where the vaginal muscles contract involuntarily, making intercourse painful or impossible. 2. Vaginal infections. Infections such as bacterial vaginosis or yeast infections can cause inflammation and scarring in the vagina. 3. Vaginal adhesions or scarring. Adhesions or scarring in the vagina can cause painful intercourse and interfere with fertility. 4. Vaginal congenital abnormalities. Abnormalities such as a septate vagina or a vaginal agenesis can cause infertility and other symptoms. Symptoms of cervical and vaginal related infertility. 1. Painful intercourse. Pain during intercourse can be a symptom of cervical or vaginal abnormalities. 2. Abnormal vaginal discharge. Abnormal discharge or bleeding can be a symptom of cervical or vaginal infections. 3. Infertility or difficulty getting pregnant. Difficulty getting pregnant or experiencing recurrent miscarriages can be a symptom of cervical or vaginal related infertility. Diagnosis and treatment. 1. Pelvic exam. A physical exam to check for any abnormalities in the reproductive organs. 2. Imaging tests. Ultrasound, MRI, or CT scans to visualize the cervix and vagina. 3. Colposcopy. A procedure that uses a special microscope to examine the cervix and vagina. 4. Surgery. Surgery may be necessary to remove cervical or vaginal abnormalities, such as polyps or adhesions. 5. Hormonal treatments. Hormonal medications may be prescribed to regulate menstrual bleeding or treat conditions like cervical insufficiency. 6. Assisted reproductive technology, ART, procedures like in vitro fertilization, IVF, may be necessary for women with cervical or vaginal related infertility. Subscribe, like, share.